Hi, everybody. For week 7 clinical conference, I saw a patient, GK, who has a past psychiatric history of anxiety and depression, and she presented to the emergency department after an intentional overdose with mirtazapine, Zoloft, and Focalin yesterday evening. The patient has been consistently experiencing anxiety surrounding her schoolwork, including the volume and the content of the work. She's been struggling with her English class and as well as her law class as well. She notes that she finds it difficult to talk to her mother and stepfather about her feelings of anxiety. And she feels that her mother doesn't really prioritize mental health in the household. She gave a specific example of not eating breakfast before she went to catch the bus to go to school. And she didn't have time to eat, but her mom told her that she needed to eat. And she asked her mom, "Well, do you want me to eat or do you want me to go to school to catch the bus?" And her mom didn't say anything. Also, she feels that her mom's not really very supportive of her in the home and just very pushy when it comes to her achieving good grades and also participating in soccer. And she feels that her mom is just seeing her as being lazy and not necessarily as really being aware of the anxiety, the amount of severe anxiety that she has surrounding school and also the relationship with her father. She's really worried that her mom will become upset with her if she does open up to her about her feelings of anxiety and depression. So, because of all the stress that she's been going through, her grades have suffered. Um, Previously, before all this, she's was an A student and was doing really well. But then, because of all of the stress, like the psychosocial things that she's been going through in school, she was sexually assaulted in school. A young boy had hit her on the butt, so there was no like penetration, but she was still assaulted, as well as the overall anxiety in school and of keeping her grades up. She started to slip with her grades, and her mother, as a punishment, doesn't allow her to see her friends because she felt that she shouldn't, her mother felt that she shouldn't have the opportunity to um, be around her friends and socialize when her grades are doing well. But when I was talking to the patient about all of this, she feels that her friends actually help her to stay focused on her school and they help her to stay, you know, on track with her grades and things. But her mother sees it totally differently. She feels that it's more of a socializing thing. So there's definitely a lot of distance between what the patient is feeling and experiencing and what the mother is observing and feeling and experiencing as well. So when we went to see our patient, GS, she was laying in bed with a shirt and some yoga pants. Um, she was able to wake easily, and when I was talking to her, her speech, you could tell, was very accelerated, and she became tearful several times when she was talking to me about what was going on. You can really tell that her anxiety is like extremely severe just based off how she just communicates. Her speech is very pressured. In fact, it almost reminds you of like a manic, just increased talkativeness, but she's not manic. She doesn't have any symptoms of bipolar. She denies any lacking a need for sleep or grandiosity or anything like that, but it's just more just really, really severe anxiety. So with that being said, um, her current anxiety level she rates as well because a lot of the stressors that were causing her anxiety have been eliminated since she's been here waiting on a psychiatric bed placement. So her axis 1 is generalized anxiety, axis 2 is deferred, axis 3 is performing poorly in school, failing classes, and feeling stressed about the relationship with her mother. Axis 5 is emesis, and due to her anxiety and some recent weight loss, and axis 4, and then axis 5 is 30. And for a research article, I found an article that just talks about the lack of beds in Michigan, especially in the Upper Peninsula and rural areas. Currently, Michigan is experiencing an extreme shortage of psychiatric beds and placement, and it's taking weeks for us to find placement for our patients. And this problem is especially bad in the Upper Peninsula, where even before the pandemic and the increased need for psychiatric services began. So we definitely have to start becoming creative and finding other ways to find placement for our patients. Thanks. Let me know if you have questions.